Hi, Cathy. How are
Hi,
you?
good morning.
Uh, Good morning. It's amazing that it's still morning. I feel like I've already spent a day working already. How about you?
Yeah, especially in our new, I would say, COVID environment. We very diligently start at a group starts at 7, I start at 8. It's not flexible anymore. Let's put it that way in terms of how we come to work every day. So you feel like you almost have a full day under your belt by the time you get to noon.
So I wonder, we're a few months into this pandemic. Tell
Yeah.
us just about your experience, both as an executive leader, but just also as a person. How have you endured the last few months?
Yeah, sure. I mean, we were reflecting the other day, so think back to the middle of March. And all of this stuff just starts to crash down on you, around the middle of March. So what we did is very quickly, we do have our disaster preparedness, emergency response structures to rely on. So we very quickly put that in place. Our entire health network, and in partnership with the Medical College of Wisconsin, put that in place. It's called an incident command. Started meeting every morning at 7 o'clock in the morning. An operations group would meet, and then they would have a phone call with me. And of course, all this is virtual and phone calls and everything at 8 o'clock. And we were dealing with it just rapidly changing environment. At the time, no one really knew in the middle of March where this was going to proceed. So I would say, first and foremost, what we started with is we got direction from the federal government that we needed to empty out our hospitals to be ready for hundreds of COVID-19 positive patients. And so we set about to do that. So that was probably our first thing. How do you cancel surgeries? And when people say elective surgeries, quite frankly, those were non-urgent surgeries, so we had to use our physicians' guidance, what patients had to be seen, who didn't have to be seen. So we're doing all of those different types of things, clearing out the house. And then we had to get prepared literally for hundreds more that might be coming through the door. So we went about working on a surge plan. Where could we put, how do we fill our traditional units? How do we open non-traditional units? So then you find the beds, then you have to find the people, to take care of all of these additional patients. We literally could have increased our capacity by 40%. So we had to train people who work in our clinics to be able to work in the hospital, in case we needed them, to be able to do that. So how do you retrain everybody, to be able to do that? How do you acknowledge that in a different environment of safety, given this disease, that it's not safe for our patients at that time to come into our clinics? So we very rapidly took advantage of the fact of the investments that we had made and virtual care over the last couple of years, and we're rapidly able to redeploy our physicians and our nurse practitioners to seeing patients virtually. And we were able to do that very, very quickly, because until we could get our safety environment put in place, we really didn't want them coming into our clinics. We had to implement all of that. And people think about our clinicians, obviously, and we were also as well, but we had to get everybody out of our corporate center. We had to get them to work at home, because again, we weren't ready for a COVID environment. So we sent almost 10% of our workforce home. And all of this that I'm talking about was accomplished in 2 to 3 weeks. So I mean, you're doing this, you are literally meeting every morning, you have check-ins during the day, and we use that incident response rhythm, to be able to do that. So a lot of work went on at the beginning. I think when it became apparent, probably around the middle of April, that the hundreds of patients that we would see were not going to happen, at least not right now in this community. And we really just continuously have to thank our community for that and adhering to safer at home from the middle of March, through early May, because that is what kept us from being overrun. I mean, it worked. And everybody made a huge sacrifice to be able to do that. But it worked for us in southeastern Wisconsin.
So, when most of us, I don't think I'm alone in this, when I think of uh, healthcare, and more specifically, when I think about hospitals, I think
Yeah.
about a crisis-prone environment.
Yes.
And, you know, there's few industries that I would expect to be more prepared for crisis management than healthcare. did that actually play out, or?
You know, it really did. I mean, we instantly know what it's a very official structure. Incident command is an official structure. We drill it, we practice it, we use it in emergency preparedness. So we knew what to do, you know, immediately in terms of going to that structure, and health systems across the country did that. So we did that. You know, what I think was different with this is the uncertainty of the disease. You know, really, we were getting daily changes from the CDC about how to take care of these patients. Daily changes about different ways to treat these patients. And then, of course, I think it's become, you know, everybody knows this, we started to run out of supplies. You know, so because this disease is dangerous, because it is very infectious, we started to burn through what we call personal protective equipment, think goggles and gowns and masks and all these kind of things at unprecedented levels. Well, so did every other health system in the United States, and there became a shortage virtually from the beginning, you know, of dealing with this. So I think we relied upon our structures. I think that that's really what got us through this. But at the same time, we were dealing, I think this was an unprecedented crisis that we were dealing with. It wasn't like we might say a flood, a snowstorm, a fire, an IT outage, which is kind of a contained event, which is what these are usually geared up for. This was just a continual day by day by day by day, you know, and literally sometimes hourly. I mean, my team, we were 24/7, you know, for the first 30 days. And these meetings went over the weekends and all for hours, you know, I mean, just what changed today? How do we communicate? We very quickly got into a mode of daily communications. We had a rhythm to it, you know, what are the decisions, what are the things we need to communicate? And we sent it out every single day, you know, to every single staff person, physician, clinician who works at a Froedtert in the Medical College of Wisconsin, not just hospital, facility, corporate, everybody. So they knew what was going on, why we were making the decisions we were. This changed today, trying to make sure that we have reminders. And we're still doing that, quite frankly, to this day, as we start recreating the environment of bringing patients back in a safe environment. So I've told people, I'll be very blunt about it. I've been in healthcare for almost 35 years. I have lived through H1N1. I have lived through incidents at hospitals. We have had financial crises that I've had to deal with in the past. Those first 3 to 4 weeks were probably about the most stressful thing I've ever gone through, you know, in my career. And I think that it was more the uncertainty, just about the changes and not understanding this disease and the progression of the disease, watching what's going on in New York, or even at that time more in Europe, you know, kind of wondering if that was going to happen here, calling our colleagues across the country. You know, we all have connections in New York and on the West Coast, you know, what's going on. Very quickly got into a rhythm with my health system colleagues right here in southeastern Wisconsin, using the Milwaukee Healthcare Partnership, which we've all had in place for over a decade. Twice a week, we were on the phone, you know, the health system CEOs, CEO of Medical College of Wisconsin, you know, making sure that we were comparing notes with each other, knowing how we would coordinate as a region, you know, not just, you know, as individual health systems. And quite frankly, we still continue, you know, those phone calls to this day, because the disease is still here.
Because it's still so present. So, you know, I wonder, thinking of your role as a manager and as a leader, I would presume you'd agree that 2020 on a number of levels will prove a case study for management students for the next 100 years. But
Yeah.
reflecting on you know, the early parts of the pandemic and everything else that's happened, do any of your sort of decision-making moments or specific decisions, did any of those ring out as really consequential in a way that you expect to learn from them moving forward, or you're proud of them, or you think that they were difficult but corrected? Any of those singular decision moments come to mind?
Yeah, you know, I probably, as I reflect on that, probably say two things. First and foremost, you know, everything we did, we had to decide we don't have enough beds, literally physical beds, to put all these patients in. I remember the morning we had to have that conversation, and everything was just go get the beds. It was just, there was never a financial consideration at all to get the resources to our team that they needed to have to be able to take care of the patients. If we didn't have the right masks, it was simply because they were not available anywhere for any price whatsoever at all. We were just trying to secure this stuff as fast as possible. So I think that there was a lot of that, that we were trying to do. And I'm very, very proud of that. We never once, considered financial resources. We were very concerned, I think, early on also about what the uncertainty was doing and the impact on our teams. How did we get resiliency resources? We brought in our employee assistance program on site, opened up rooms where people could go, just because of the stress that our own teams were going through. That. So I'm very, very proud of how we reacted and what we reacted to, as we were doing all of those things. I think the other thing that we're finding as we came through this, and I'm hearing this from my colleagues in a number of different industries, not just healthcare, is that we made decisions very, very quickly. People reflect in the back is some of these are major decisions to spend millions of dollars, making sure that we're getting resources, benefit programs that we put in place with our employees like overnight, which we could do because we run our own third-party administrator to make sure our people were taken care of. We made these decisions in 24 hours, whereas before we would have taken weeks at best, optimistically, to get some of these decisions made. So decision making and the speed of decision making, and I think if anything, as you said, a case study, a business study about what comes out of COVID is understanding that we could do that, and that we could be agile and that we could move, and these amazing changes that we made to our organization in a very, very short period of time. And really what we've done is we kept our same structure in place. We changed our teams up a little bit to actually build our recovery plan, about how we bring patients back into a safe environment and all of those different types of things. So it's been a great learning about what you can do if you really change up the way you make your decisions. So I think those are probably my two observations. Very proud of us in terms of the resources that we put in place to take care of our patients and our staff and our providers, and then lessons learned that we'll take away from this, in terms of decision-making capabilities and how to do that.
That makes really fantastic sense. And, I'm hearing from a lot of executives that fortunately they validated their team structures, they validated their teams.
Yes.
And, that's actually a little bit of good news in the midst of all this challenge. So, one of the things that we understand from COVID, and we understand specific to where we are, is it's had disproportionate impacts on communities of color.
Yes.
And I wonder how you all, and we've been lucky enough to get the updates from Dr. Raymond during the GMC meetings. I wonder how you all identify a strategy to address that issue directly. Can you talk about that?
Yeah, and we did. It didn't take very long, for that data to emerge. First, I would say in the African American community, and then certainly the South Side, and the Hispanic community. And the case counts are just disproportional, to the population. And that came out very, very quickly. So I would say a couple things that we did. We do operate 2 clinics in the city, one at McKinley and 6th, and one up on Good Hope and 76th, making sure that, we had access to our patients, that we take care of. But we actually do a significant amount of our outreach for healthcare into the community through our partnerships with federally qualified health centers, with the FQHCs. So we immediately reached out to 2 of our closest partners, 16th Street on the south side, Progressive on the west side, connected with Milwaukee Health Services up on the north side, to make sure, what can we do to help you? Because you guys are here, you're in the community, what can we do to help you? And one of the first things they pointed out is they didn't have access to tests. If we remember back in March, there was no National Guard, out there on testing sites. Access to getting a COVID test was very, very difficult early on in this, and turnaround times and all these different types of things. That happens to be something that Froedtert and the Medical College have an amazing asset with, which is our lab. And it's not just a hospital lab, it's a reference lab. And some of these folks were our partners already. Okay, great, what can we do? We have lab capacity. Let's match that up with your patients, make sure that we can get these folks tests, as fast as we possibly could. So I'd say that was probably the first thing, that we really, and to this day, we're still doing, their lab testing, right now. And our turnaround times are less than 12 hours, so I mean, folks who are coming through there are getting their test results very, very quickly. And we continue to support that, as well as our own testing sites, and all of those different types of things. I'd say number two is it was very apparent, particularly on the South side, that maybe there had been a gap in translating information into Spanish, in terms of making sure that people knew how to take care of themselves. We assisted with that. And we've changed our own, communication to make sure that we have bilingual communication available so that people could keep themselves safe, so that we did that. The other leverage that we had that we relied on, and it is the strength of our longstanding diversity and inclusion program, is we actually have a connection with Milwaukee Film's Minority Film Series. And we immediately use that as a way to bring people in and open up a dialogue, a panel for questions, around what's going on with the disease, particularly in populations of people of color. We had hundreds of people, bigger numbers than we've ever had before, coming in from the community to ask questions about what they could do to keep themselves safe, their families safe. So that's just a couple of the things that, we reached into to do that. I think that this work is going to exist way beyond COVID. It just reinforces the issues that we know that are there in underserved populations, whether it's from social determinants of health, access to healthcare, underlying health conditions. Those are things we look at every year. Those are things that we try and put programs in every year. There's nothing that one body, one system, one company can solve on their own, which is why we use Milwaukee Healthcare Partnership with our other colleagues to do that. But we are already consciously looking at our efforts and say nothing else coming out of this COVID pandemic, and then obviously followed up with our social unrest that's coming out, as well, as we just have to do better. So how do we, and we're very, very consciously looking at that right now, have a lot of data. Okay, we know what it is. Now, what are we going to do about it? And how do we engage our communities to understand how we do a better job on that? That's going to exist beyond this pandemic, and we have to redouble our efforts in that way. As a
I'm glad you said that. And the challenge of this format and the time that we have for it is there's just more going on than we could possibly address. But I will ask you this. How are you making sense of how to use your role, your reach, and your capacity to make things better and to do better? How do you manage all that?
So I'll reflect personally first, and then kind of take it in. So I think all of us know, and we reflected on it actually in the breakout group that I was able to participate in with the GMC meeting, last time. And three of us on there we're all women the same age. I know everybody, we're moms. It's the engagement of our younger people across our community. And we were reflecting on the fact that they are engaged in a different way and calling us out, quite frankly. My generation, me personally, getting called out, by my children about, well, what are you doing? It's given us a great dialogue to say, well, this is what I am doing. Quite frankly, they weren't aware, a lot of that. But really, as I always tell my kids, when you get into these positions, you have an obligation to use your power for good. And my daughter was really saying, Mom, this is a time you need to use your power for good. And so we very early on went out with, we wanted to make sure that our people who are associated with Froedtert and the Medical College of Wisconsin knew where we stood very quickly on everything related to that. We've gotten our messages out. You get messages out. But I think the second thing that we did internally, we do have a very robust, over a decade old, diversity and inclusion program Okay, go to your folks, I mean, we called a special meeting right away and said, what do we have in place that we can deploy quickly? But more importantly, what are we not doing that we really need to do, here, where are the gaps? And we had a very frank conversation about, well, this is great, but did you realize they have your support, Cathy? Maybe they don't have their one-up leaders support, in terms of really being able to share experiences and have a dialogue around this. Okay, how do we do that then? How do we make sure that those leaders are accountable? We have many leaders around our organization that simply feel incapable of how to have these conversations. How do we get them some help? How do we get out with some leader drop-ins to be able to give them some talking points? Because our first and foremost is we have to support our people so that they know that this is a safe place. They have to know that we stand up for them and stand against these actions. And then we have to take actions, to do that. So I would tell you, we're formulating our way. I think we're relying on those structures that we had in place from the very beginning. But we are finding out and talking to people about, what can be the impact, that we have. And again, I would tell you, we're putting it in a COVID lens, but it's COVID and everything else that's happening in our community and our society right now. We're taking a very hard look, quite frankly, at our strategic plan and saying, are we doing enough? Do we need to redial our efforts? And it's, quite frankly, it's one of the top 5 things, that we're going to redial our efforts to do that. So I'll admit, we have some good structures in place we'll rely on, but there's more, that we have to do also as well. And no one to hold you more accountable than your kids. And they're looking at me, as well as my whole entire team. They're looking at me right now, in terms of what we're doing.
Yeah. I appreciate that that perspective. And I would love to give you a moment to offer advice, counsel, or even a challenge to your GMC peers. What would you have them do, considering your unique perspective as an executive in healthcare, your less unique perspective as a mother, your membership in this community? What would you have folks learn, understand, and do to respond effectively to everything that's happening?
I think first and foremost, we have to realize it's almost like going back to the Safer at Home, initiative. Our community came together, we had an emergency, we paid attention, and we followed the guidelines. And we were able to avoid a disaster in this community when we did that. So think about how we all acted together to do that, to the benefit of our community. It's not that people haven't died. It's not that people haven't gotten sick, but we so significantly reduced the damage to our community by doing that together. One health system, one company, one organization. The government cannot do this alone. These issues that we're dealing with in our community are so systemic, so ingrained, have been here forever. We have to act as a community, and we can do it. That's what we're finding out through this pandemic. Yes, you can, and you can do it quickly, and you can come together. I think we bring a unique perspective in healthcare because we have served these communities for a very long time. We have some connections, that we can have dialogue with and that we can go to have dialogue. We need to do more. But I think if you don't have those connections already built, with the folks who are being impacted, start setting up those connections. How can, we talked about in my breakup group, how can the GMC be a convener, about how we make those connections in a different way. And I think we have to challenge all of ourselves. We might've been doing some good work, and I think we all have been doing good work. Are you making impact by that work? I'm really challenging my team to say, this is a problem. We've had it identified in our data. We know this healthcare disparity. What are we doing about it? And if that number isn't moving, then that means we're not doing it for impact. How are we going to do it for impact? So I think really challenging ourselves about learning more, listening more, having more conversations with people about things we don't know about, and then really challenging our organizations and our community to come together and do things for impact. That's, I would say, is where I sit, relatively short, into this, but that's how we're driving our organization right now.
I think that's really great. You know, uh, when all of this started, specifically the safer at home orders and uh, the response of quarantining and social distancing, we started taping these conversations. And many interviews ago, I started asking people about their regimen of self-care in a moment when we thought, frankly, it couldn't get any worse. And then the fight for racial justice became a front and center concern. And that work, which for some had been always a parallel process, became a priority for everyone.
Right.
But I still think it's worth asking about your regimen of self-care. What are you doing? What have you been listening to, watching, reading? What are you doing to make sure that you are the best vessel for change and leadership that you can be?
Yeah, I worked a lot in my career, particularly over the last couple of years for self-care. And I wish I could say that, it's continued as rigorously as it has through this, and it probably hasn't, just because of the time commitments and things like that, So for me, I take refuge at home with my family. I've been extraordinarily lucky that my college-age children, for the most part, were quarantining at home. I have one back over in Madison right now. Amazing opportunity to be able to do that. They keep me going. They really do. They help me come back to work. I have an amazing team at Froedtert in the medical college. Amazing. And the collaboration, like you said, your team just shines. And so the collaboration just gives you, the strength to go on, and be able to do that. I would say the good thing about not traveling anymore, because I don't travel anymore, is that my workout regimen has been better because I can just keep it, in there. So I do that. I am trying to get back to my mindfulness. We all are on these Zoom calls. We complain we're on these Zoom calls for 6 hours, at an end. You can see more people getting up during them and stretching and because we're just, so inactive during that. But I think it's a mental well-being. It's an emotional well-being, staying connected. Couldn't see my mother for probably 90 days. We did a couple Zoom calls. How do you get through that? Those different types of things. Not forgetting those connections. We were starting to get a little afraid, I would tell you, early on in the pandemic, and we made each of our teams take 48 hours of respite. I made them go off. I'm like, you're not allowed. I'm not going to answer your email if you send it. You're not allowed on the call this morning. You have to sub somebody in, because we could just tell that folks were getting frayed. You have to consciously make time as a leader so that you can bring your best, because we all know when you don't sleep, when you're stressed, when you're, don't feel healthy, that impacts your performance. So, it was hard for those first couple of weeks, and then we got ourselves back on track. We have to do that.
Could not agree more. Cathy, thank you so much for making some time for this conversation. I'm really glad that you have you've been such a vocal advocate in the new, very difficult conversations we've been having internally, and appreciate your willingness to kind of keep us moving forward. I hope we have a chance to be in one another's physical presence in the not too distant future.
Yeah.
And until then, please do continue doing the great work that you can do.
Great. Thank you for the opportunity to have a chance to share what we're doing. Thanks, Elmar.